All right. 3:39 start time. Well, 3:40 start time.
All right. Hi, my name's Abigail Sutton. I'm a student pharmacist. How are you doing today?
I'm doing good, and I'm here to pick up my prescription that my doctor recently sent over.
Okay, perfect. Can I get your name and date of birth?
Javi Hill, November 11th, 1954.
Perfect. So it looks like you were prescribed prednisone. Does that sound right?
Yes, that sounds correct.
Okay, awesome. Do you have a few minutes to talk about this medication? Awesome. So what did your doctor tell you, or what do you know about this medication already?
I've been told it's supposed to help with my COPD, but since it's a steroid, I thought it was something that athletes took and it was bad for you. How would this help me with my COPD?
That's a great question. So there's actually different types of steroids. So they are both steroids, you're right. But the steroid you're thinking about for athletes is called an anabolic steroid. So that's what you're thinking about. And then the prednisone is actually a corticosteroid. So corticosteroids are naturally produced. They're actually a hormone that's naturally produced in your body, and they have anti-inflammatory effects. So we're just trying to boost that up so that we can open up your airway, decrease your wheezing, coughing, just open up that airway so you can breathe better. So they are a little different, but I do see your confusion.
That
Do you
makes
have any
sense.
other questions right off the gate?
Not right now.
Okay, perfect. Is that all your doctor told you about it?
Yeah, that's the most of what I know about it so far.
Okay, perfect. So I'm just going to go over your medication, how to
Okay.
take it so that we can make it the best for you.
Sounds good.
So it looks like you were prescribed prednisone. The brand name for that is Deltazone. So it's just referred to both if you ever are wondering. And you'll be taking two 20-milligram tablets for 5 days, and you'll be taking that once daily. So that's a total of 40 milligrams per day for 5 days. So this is usually prescribed for COPD problems with COPD. Is that the case for you?
Yes.
Okay, perfect. So this is the medication to be on. It should help, again, open up your airways and just help you breathe better. So like I said before, two 20-milligram tablets per day by mouth every 5 days. I mean, not every 5 days, for 5 days, excuse me. And you should take it in the morning and with food. And then if you miss a dose, take it as soon as you think about it, or if it's too close to your next dose, just skip it. Don't ever double up on doses. That could be dangerous. And then you should see improvement with your COPD within hours or within days. It changes per patient. So if you don't see any improvement after 2 days, make sure you call your doctor so that we can get you on a new medication that's gonna help you out.
Okay.
Because we do need you breathing. There are some common side effects with this, and that includes upset stomach, throwing up, trouble sleeping, restlessness, dizziness, headaches. Those are common, but it's also common to not get any side effects. So just be aware of that. And then also some more serious side effects would be allergic reactions, such as watch for hives and rashes, as well as mood changes, changes in your heart rate. And then if you feel or experience an increase in chest pain or tightness, make sure you call your doctor right away, because that's the opposite effect of what this medication is supposed to be doing.
Okay.
I also noticed that you have hypertension. So just so that you are aware, prednisone can increase your blood pressure. So just make sure you monitor that a little more closely for the next 5 days. And then if you see anything out of the ordinary, call your doctor. I would say 10, 15 millimeters of mercury difference, call your doctor. That way we just make sure that nothing's bad's happening. And then last thing that I want to say is after your 5 days are up, if you're experiencing weak, dizzy, tired, confused, anything like that, call your doctor. It could be nothing, but it also could be something. So we want to make sure that we are staying healthy. I know that was a lot of stuff. So I'm just going to tell you one more thing. Remind you of one more thing. If you're not seeing improvement after 2 days, make sure you call your doctor so that we can get you breathing again. What questions do you have after all of that?
I don't think I have any other questions after this.
Okay, perfect. Can I have you actually summarize kind of what I just said, just to make sure that I got everything out that I needed to?
Let's see. I take 2 tablets a day in the morning to avoid some restlessness, I believe. And then should monitor for my blood pressure too and check for improvements after 2 days. If it doesn't, reach out to the doctor to try to get a different med to help me with my issues.
Okay, that sounds great. The only thing I would add to that is make sure you take it with food.
Oh, take it. Okay.
Yep, do you have any other questions?
No, that'll be all.
Okay, perfect. Well, if you have any come up, just let me know. You can call me at any time. And thank you for your time.
No, thank you.